Zoll technology will guide you to meet the 2015 CPR guidelines. High-quality resuscitation on the move is achievable, and high-perfusion CPR is within reach. When it comes to helping you deliver high-quality CPR, no one offers you more than Zoll.
Well, I have to send in my apology first. Actually, I was supposed to be part of the judge for the earlier segment, but for whatever reason, on my calendar it's 3:30. So if I stuck to that timing, I would have arrived after this. Anyway, well, still in the context of medical education, I'm not sure if you have, or you have actually the same feelings that I had when I sat through a lot of communication sessions. We've been taught how to do a certain thing. We're taught how to behave. Basically, we're taught what to do, how to conduct a communication session. Now, I've always been wondering, why do we have to do a certain thing? Like, why do we have to paraphrase? Why do we have to adopt open posture, whatever? So today, instead of actually giving you another session of that, I thought it's more important to break the code for you. Because I think after a while, we sort of know how to use a certain principle and use it in our own context. And I'm not actually that familiar with the ED context. I mean, I did my ED posting when I was a site trainee a long time ago. Yeah, and that was very good. But in that era, we didn't really talk about, communication and whatever, we get job done. So, but today, I believe, whatever subject you're doing, perhaps with the exception of pathology, communication is essential, whatever you're doing. So, let us get on to some of these important principles. Okay, that's myself. Now, you have heard of this, right? And some of you have gone for this training as well. Now, I'm going to introduce you a new book. That's 7 Secrets of... It's coming hot out from the press, yeah? Okay, let's get down to the first secret. Now, this body language is super important. You have heard of, how you should actually watch your body language, whatever. But let me start from the beginning. Our body cannot lie. So, despite our best training in communications, we might actually mean to say a certain thing. But the truth is, our body cannot lie. So very often, even though we are trained to say the correct word, but our body will betray us if we are really not aligned with our intention. So all this you are aware. Now, why is that so? It's because we are all wired from young, from birth. Now, if you actually, if I ask you to actually fold your arm, for example, you will actually fold your arm in a certain way, either left over right or right over left. If I've asked you to actually do it the other way around, it takes a bit of practice because some of these habits, together with a lot of our body language, they are actually wired right from the moment we're born. So when we are born, our parents try to make us laugh, so they'll try to say agugu or whatever, right? They'll try to actually tickle you to make you smile, laugh, and therefore, when you're happy, you smile. It's not easy to actually make an angry face and say to your loved one, "I love you." It's not easy. It takes a bit of practice. The same thing with to say "I'm angry with you" in a loving way. It is not quite easy, not so spontaneous for us to do. And it is very important to also know that actually the words that we actually speak conveys just about 7%. It does 7% of the total communication experience. The remainder actually accounted for by tonality and body language. So we cannot really don't speak. Even silence can be heard sometimes. You know what I mean. So let's look at this pair of friends, some park in London. You can see that when people are in sync, they are flowing together in communication. Their body language will actually more or less mirror one another, very automatically, and that's why. When we do communication, we want to actually mirror because it gets us into get in sync with one another, somehow psychologically. This another pair of friends. Now, this pair of personalities, even without knowing what they are talking about, you can more or less surmise what's going on there. And this one, okay? Compare this with this. Okay? So it can actually really quite easy to actually tell what's going on, whether it's going on well or not. And very often in clinical communication, it's like that. We meant to say a certain thing in a certain way, but it came out differently. And patients, even though they have not gone through any communication course, they can tell, they can sense that actually it's not quite going the way it should be. Now, therefore, the second secret is related to the first one. We have to be actually aligned with our whole intention. If you're not aligned, it comes out the other way, and despite what we say or what we mean to say, our body will tell us a different story. Now, to illustrate that, let me actually tell you a story. That's 2011. This is actually Mount Kinabalu. Some of you might have gone up there before. And if you've done that before, you know that it is actually a two-phase expedition, right? You have to actually reach the base camp, and then you tuck into bed right straight away, about 7, 8 o'clock, so as to wake up at 2:30 in the morning to hit the summit. Now, so in 2011, about 30 of us went up. So when we were reaching the base camp, a radiographer was actually started to actually puke. Not adapting very well to the height, the altitude. So, okay, a few of us, men, we carried her for the last 50 meters. Okay, that was quite challenging. And if you know about the base camp, right, the last 50 meters was actually kind of steep. But anyway, we did that, but she didn't improve. Of course, she got worse. And then she continued to puke. She couldn't take in fluid. So whatever we do, actually it wasn't helpful. And about an hour or two later, actually her pulse, I thought, became thready. And we are really quite worried. Now, of course, you guys are familiar with what to do, right, with altitude sickness. What's the best thing to do? I mean, I can't call in a helicopter. The next best thing is, of course, to send her down. Now, so of course, the next question is who? Okay, because we all trained for 3-4 months and we all want to hit the summit. Quite eager to hit the summit. And of course, among the 30 of us, there were 2 doctors. One is yours truly and the other one is my wife. So it didn't help. Now, I had a bit of struggle at that moment because I really wanted to hit the summit because, certain things you just want to do it once and get it over and done with and been there, done it, right? But then I realized that, for the rest of them, or the rest of the 28 of them, their summit will be going up. But for me, my summit actually is to go down. So for that night, it just struck me that once we put on our white coat or when we swing our stethoscope around our neck, somehow, you can't run away from some of these things. Can you imagine how embarrassing it would be if it wasn't me who actually went down with the radiographer? So, of course, the rest is history. We went down. And, of course, I didn't carry her down. And of course, the porters were the ones who actually did a marvelous job. They can actually just, chong down without quite looking at where they are going. And actually, I was lagging behind. But anyway, of course, within the next 3 or 4 weeks, my wife and I went back again to hit the summit. But that's just to wrap up the story. But I realized that once we put on our white coat, whether you like it or not, our objective in life somehow is shifted, whether you like it or not. So I just read an article, somebody posted it on Facebook. So on a plane was this radiologist, and then someone asked for a doctor, and then this radiologist was not sure whether he should respond. And some of you have read, right? In the end, when he was trying to slow down the whole process, a radiographer responded, to the emergency. Now, that tells a lot about how, we actually today, as a doctor, should align ourselves to patient care. Now, today we are all very specialized, whether you are anyway, I'm a psychiatrist, right? What have I got to do? Altitude sickness, but anyway. You can't run away from that. So, it will be actually a little bit patronizing to tell you that the patients are our kings. But the truth is, if there is no patients, we all can pack up and go home. You don't even need, a clinical researcher actually, because it's irrelevant. But as long as there are patients, and as long as we actually call ourselves DR, then we have to align to actually the total care of our patients. Now, that has got everything to do with communications, because if it's not part of your objective in life, right, or your objective in life, then in your communications, it will come out, this is not my problem. I'm looking after the right eye. I'm looking at the left toe of the patient. Patient's emotions, patient's distress, these are not my problems, okay? And then your body language will betray you. That is the whole relevance about that. And you can't run away wherever you are in this world, right? As long as you're a doctor, there's these great expectations upon doctors. And we are all familiar with that. Now, the third secret is this. People really like people who are like them. So, this is burned into our psyche, okay? People like people who are like them. So if a boss likes like blue checkered shirt, right, you know what to do. You just wear blue checkered shirt. You know? Yeah. Now, there are actually two main secrets. One is people like people who are like them. The other one is people like people who like them. So we will talk about people like people who are like them first. So that's why in many communication lectures, workshops, or whatever, they'll teach you to be like the patients. So that's why you have to paraphrase. If they adopt an open posture, you have to adopt an open posture. If they actually sit forward, you have to lean forward as well. If you sit backward, you do a bit of relaxation with them as well. Now, the whole idea is to be like them, so that psychologically, the patient feels that you are with them, really. That is actually the whole secret behind why we are actually taught to do a lot of things in communications. So how to do that? Now, it is something that is actually in our nature as well. If you don't like someone, if you don't like to talk with somebody, what do you do? Yeah. Now, don't pretend you don't know, right? Of course. So, how do you avoid? You'll be very rude to just walk away. So, you want to create a mismatch. If they talk loudly to you, you talk softly. If they talk fast, you talk slowly. And if they move up to you, you slowly turn away from them, right? So it's very easy. And if they talk about one topic, you try to mismatch a little bit. You shift your focus to talk about something else. Now, for us guys, we talk to some sweet young ladies, right? What do? If you notice the tip of your shoes, right, you actually will rotate towards the target. We'll try to match. So that is the whole idea. Why, in communication courses, you're taught to do a certain thing. It's because you want to match. And if at all possible, you want to even match the things that they say. That's why some people, the salespeople are very good. If you are a visual person, they will use the visual words with you. Does that shed a light? Let me show you. I see. They will use the visual words with you. So they are to that level. Of course, in clinical practice, I think we don't have to go to that extent. But it is actually important to know the principle behind. Why do we do things like that? So you look and develop sameness. And in terms of our communications, you want to actually talk about the same topic. So your boss talks about, say, play golf, right? He's a golf fan, golf. So what happens if, let's say, your favorite game is not golf, like ping pong ball? How? I'm quite sure your boss wouldn't be very interested. If he talks about golf, he talks about ping pong. Now, there is this thing called chunking up. So you chunk up to the next level. What is playing golf about? It is about leisure. It's about sport or whatever. Then you talk about sports. That is how we go about chunking up to the same level so that you talk about the same thing. And it's actually applicable with your colleagues, with patients, even in social contexts as well. Then you, of course, can match all sorts of things, all sorts of ways, whether it's in terms of posture. If you remember earlier, I showed you those pictures. Those people are actually either match or mismatch. You can actually make a judgment. And that's how things will actually manifest in your body language. Now, if you talk with your friend, and he's actually with his arms folded, and you are sitting this way, if your conversation goes really very well, after a while, either one of you will change. Trust me, either one of you will have to change, because it's just very funny. Someone sits like that, and the other one like that, and the communication cannot. Somehow it takes quite a lot of effort to go on because there is a mismatch. Such is our psyche. Now, why is this so important? Why is this photo actually even published in the newspaper? Because that gentleman in blue is actually the Emperor of Japan. And if you know about the Japanese emperor, they don't kneel. But this guy knelt down when he actually went on tour to visit those disaster-hit areas. Can you imagine if the king or the emperor came down and then without coming down to the level and then, trying to comfort the people, it's going to be a failure. So this guy obviously knew about it. So actually an emperor earlier also did the same thing, and that's why both of them made it to the news. Yeah. You cannot actually lead 5 minutes. I'm on in first, that's secret. Okay. Anyway, the whole idea is you have to pace before you can lead, and in clinical communication, it is like that. Why? PAP? No. Okay. Because there is a total disconnect sometimes. No matter how great you are, how good you are as a clinician, if there's a disconnect, the best advice will not be adhered to. So always remember, you have to pace before you lead. And once people are with you, you give advice, people will follow. A lot of us have done leadership role position before. And if people don't feel that you are with them, you turn around, no one's behind you. It's a very simple, common sense thing. So you bring that into communication. Okay, very quickly, secret number 4. People like people who are like them. Okay, I'm going to go quickly on this because it's quite common sense. People like people who are like them. People like people who like them. So basically to show care, show respect. And how do you do that? Openness. That's why sometimes, even though we have to do interrogative kind of questioning, clinical clerking sometimes, do a bit of open communications. You have to bring that in because it is a show of respect, because you're giving the person space, time, and option to answer and not to answer you. When you go in to take information in a one-sided way, it is a very unequal power status if you do that. But very often we are not aware of that. We are just going in to get, and patient just give. From psychological perspective, it is a very unequal position. And sometimes people can sense that you don't really actually give them the due respect. But anyway, so just be careful because we cannot also use all open question at A&E. I'm mindful of that. But once in a while, you have to actually throw in a bit of this just to show your respect. And the last thing about these people like people who like them is the use of the word sorry. So I'm sorry that you can be used big time. I'm sorry that be careful when you say that. Okay? I think that has been touched on in other communication. I won't go on for it than that. Okay. Secret number 5 is to create emotional resonance. This is actually the inner counterpart of the external sameness. So much as you create the external sameness, you want to create the internal sameness so that people feel that emotionally, whatever they are experiencing, you are feeling along with them. How to do that? By not saying a lot of things, by letting them have the space to express their feelings and emotions, and by validating whatever they say. For example, they say, Doc, I feel depressed. And of course, trained as a doctor, we will say, why? Or my sister scolded me, why did she scold you? And so on, so forth, right? But consider changing text once a while. Doc, I feel depressed. Oh, that must be terrible. Just reflect back to the patient once a while. And straight away, the patient will get it. They will know that you are actually going along with them. You are actually giving them space and you are feeling along with them. So try some of these things once in a while. And you'll be surprised, they'll pull out more things that you want to hear sometimes. But anyway, the end point is they'll take you over to the other side and they'll treat you as part of them. Okay? And it's actually quite powerful. So it's more than just physical togetherness. But all right. Now, secret number 6. People don't fight people who want to fight them. Now, ED department is a war zone, right? And very often, everybody is so fired up in a negative way. People are waiting, and sometimes anger can actually fly quite high. Now, the key, so it's very important to know this, that people don't fight people who don't want to fight. Now, imagine if you roll up your sleeve with your golf club, going up to fight somebody, and then you see this little kid, right? He at you, right? What would you do? Now, I bet you would actually drop your golf club, unless you're a psychopath, right? Because you realize that you're completely, the word to use is, you're completely disarmed by the smile. Same thing in an inflamed situation, the key actually to stop that fueling loop about anger is actually we step down, we back down. And then you realize that the other side will also back down, and they'll be taken by surprise, actually. Okay, so things like listen, 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 and then try not to use the word but, try to use the word and a lot more. Yeah? Doctor, why, you all don't take care of my father's comfort, whatever. Then you say, yeah, thank you very much, we understand, but, we need to make sure that this. Now, you can actually use and, even in those situations. Yeah, thank you so much, Mr. So-and-so. We realize that your father's comfort is so important, and we also want to make sure that this. Actually, because we are so well-wired in a certain way, so in an inflamed situation, we tend to actually throw in these words a lot more, a lot readily, and a lot spontaneously. Try to train yourself. Time over. Try to train yourself to use the word and a lot more than but. Okay, let me just push the time limit a bit. This is the last secret anyway. So Miller's law. Even though in a certain situation you know that you got it, you got a big picture, you know what's happening, and just try to think and assume that the other party has got something to tell you, and then go in to see what is true about what they have to tell you. Okay, to illustrate this, I really have to take a bit of time to tell you a case. That's quite some time ago. An old lady came to see an orthopedic surgeon, and then sent to an X-ray department for X-ray, and then she fell, fractured her right humerus. Okay, so that's fine. That's bad enough. Okay, so but the whole episode was wrapped up quite nicely. The orthopedic surgeon apologized, sent her back for slap, whatever, and then X-ray again. So family quite happy with the explanation, the care given, and the assurance of follow-up, whatever. The same evening, she was brought back to A&E because she spiked a fever and was admitted UTI. Okay, no, so that's all. That was managed, covered with antibiotics. 2 days later, discharged. Now, 2 days later, was brought back to hospital, spiked fever again, and then 2 days later, she died. Now, family was very upset and was very sure that it's got everything to do with the fracture. Then, of course, in the ward, from houseman to MO to registrar to consultant said, nah, how can it be? Fracture, fever, they don't go together. Okay. So it ended up as a CIM case. And, I was actually picked to actually chair that family conference. And that was difficult because, even the coroner say it's UTI. There's nothing to challenge. But the family was just very, very furious and upset. So then we thought maybe they have got something that we have not quite heard from them. So in a family conference, after introducing who's what and what's who, we found ourselves actually saying this. We said, actually, it would be completely understandable why you link the patient's death to the fracture because they are so close in chronologically. And if you were there, actually, we didn't think this was the solution to this case. But when we said that, the family all sat back with us and sighed with a sigh of relief. It's as if first time someone finally understood how they felt and, someone finally entertained what they were thinking about. So you can imagine, right from the word go, right? When patient passed away, family asked houseman, MO, and everybody say no. And finally, this panel of doctors say, yeah, of course, it makes sense. But, of course, there's a but. Now, so sometimes it's actually important to keep an open mind, go into a conversation, especially when things are not going well, to really listen to things and to see what might be true in the whole inflamed situation. Because even between me and my wife, right? I mean, I'm a trained psychiatrist. I can really listen very well, no? But then in my mind, I of course say, nah, without showing it. But I can tell you, friends, it doesn't work. So this works better because very often I realize that it's not really what she wants to tell me. It's really the needs behind what she's trying to say. So sometimes we have to actually keep an open mind when we enter into a communication situation. Okay, let's go on. All right, so I've gone through these 7 secrets, and I think I'll skip this. Now, there is actually a bonus secret. Of course, the bonus secret is you can do it. So just get down to do it. And communication is actually not so woolly after all. Yeah, it's unpredictable sometimes, but actually there are certain principles that we can go by in any situations. Thank you very much.
Okay, thank you very much, Dr. Kwek. So now we'll take questions from the floor, if any.